So let's talk about our study, a randomized crossover controlled evaluator-blinded trial evaluating cannula versus needle-assisted hyaluronic acid injections for infraorbital deformities. Now, this is a prospective trial in which we evaluated the use of cannula versus needles and assessed efficacy and safety. We also looked at product requirements between categories, and we looked at overall outcomes. So now one of the key things about this particular study is that we had a 42-patient female population with a 3-3-1 design, 3 for cannula, 3 for needle, and 1 for controls. And the controls were used as a crossover and were then randomized into either cannula or needle. So a very interesting design. Now we followed the patients over 1 month after their last injection, and we looked at all outcomes. So one of the key developments in this particular study, we were able to show equal efficacy and safety between needles and cannulas when treating the tear-trough deformity. Now, in identifying this, we found some key points. The first is that almost all our patients had treatment over 2 sessions, and this may actually lead to the safety profile that we had between the 2 types of devices. One of the key findings in our study was that we used similar amounts of product between the needle and the cannula groups, and age was actually not a variable associated with using more or less product. So the use of non-animal stabilized hyaluronic acid was efficacious and safe across both techniques. The diversity of using non-animal stabilized hyaluronic acid is demonstrated in the fact that what are you actually repairing or correcting in the tear-trough deformity? You're actually correcting the imbalance between bone and soft tissues with one product. And this is unique because of the ability of the product to not integrate diffusely into the tissues and to stay where you place it. So what's next? Next steps? Well, let's see. We've evaluated outcomes at 1 month with respect to safety and efficacy. We've done a survey at 6 months looking at patient satisfaction records. Now we need to see longevity of the product at 12 months. This would be the next logical step using non-animal stabilized hyaluronic acid. And the final take-home message to novice or junior injectors: start slowly, understand the anatomy and what it is that you're trying to do, master one technique, small amounts of product, and treat over multiple sessions to achieve the ideal result. And your experience will grow quickly.